Direct primary care is an innovative, alternative path to insurance-driven healthcare. Typically, a patient pays their doctor a low monthly membership and, in return, builds a lasting relationship with their doctor and has their doctor available at their fingertips. Welcome to the My DPC Story podcast, where each week you will hear the ever-so-relatable stories shared by physicians who have chosen to practice medicine in their individual communities through the direct primary care model. I'm your host, Marielle Concepcion, family physician, DPC owner, and former fee-for-service doctor. I hope you enjoy today's episode and come away feeling inspired about the future of patient care, direct primary care.
Direct primary care to me is like the yoga of medicine. It is the lifeline for patients, for providers, and for entire communities. I see it as a tool to make our society, to leave our communities better than we found it. I am Dr. Dana with Love Health DPC, and this is my DPC story.
Dr. Dana Mincer, DO, is a family medicine physician, entrepreneur, and founder of Love Health Direct Primary Care in Fort Washington, Pennsylvania. Known to her patients simply as Dr. Dana, she combines her background as a Division I athlete, daily yogi, and soon-to-be certified yoga teacher with her medical expertise to bring a holistic, integrative approach to healing. Her passion for reimagining healthcare began during residency when, after being diagnosed with 2 autoimmune conditions, she experienced the shortcomings of both conventional and functional medicine. That journey inspired her vision to reconnect body, mind, and spirit and to restore trust in the physician-patient relationship. In addition to her thriving DPC practice, Dr. Dana co-founded Verity Advisory with her fiancé Tommy, a CPA and business strategist. Together, they consult with businesses on building cost-effective, transparent healthcare benefits, an alternative to the traditional Big Five insurers. She is also the host of the Unfiltered Doctor podcast, where she brings raw, honest conversations about medicine, leadership, and integrity. Outside of medicine, Dr. Dana is a mom, personal trainer, and outdoor adventurer who loves bouldering, skiing, and paddleboarding with her family. Her bold mission is to leave the world better than she found it and to inspire others to believe the same is possible. Welcome to the podcast, Dr. Mincer.
Thank you. Thanks for having me.
This is such a treat. We met each other for the first time at the FMMA conference earlier this year, and it was so exciting to see you again in Denver at the Hint Summit and Rosetta Fest combo there. And I will say that, what I loved laughing at remembering what happened at Rosetta Fest was that people thought that you were literally selling a cardiovascular product because you were like all over cardiovascular health and preventative medicine and lifestyle medicine. And I was like, no, she actually has her own DPC. And so we're going to be talking about that today, but I just wanted to call that out because even people who didn't know you could see your passion. So thank you so much for joining us today.
Thanks for having me again. I appreciate you bringing that up. I forgot about that, and that was very humorous.
Love it. So I want to highlight something from your past, which I think is awesome because you had studied visual communications in Switzerland. So totally different country, totally different way of delivering healthcare, and something that has not been highlighted, specifically Switzerland's example on this podcast. So I'm wondering if you could talk to us about your experience in Switzerland and how that helped mold your medical career.
Yeah. So it's so pertinent with all of the different ideas going around, at least for me, about a single payer system and what's the solution. And, while healthcare was free in Switzerland, I think it really showed me that a single payer system is not the answer. When you have that experience of being and I was right on the border, I was in Lugano, so it's the portion of Switzerland that drops down into Italy. And actually my boyfriend at the time, and this was 20 years ago, was in a motorcycle accident and he needed skin grafts. And it was like, and when he was in the accident, he was actually in Italy when it happened. So I had to go down there and get him from the hospital there. So I got to see both Swiss hospitals and Italian hospitals. And what was very clear to me was this is not what most Americans would be happy with healthcare. Not that they were the doctors. I'm not saying anything about the doctors per se, but I mean, it was sort of chaotic. The wait times were crazy, were worse than here. No one had privacy. Like people were 10 people to a room, not even curtains drawn. And I just don't think it would be an acceptable level of healthcare. So I think that really got me thinking when I came back and decided to go down the path of medicine, which I think I had been frightened to even try earlier on in my life. It really gave me a perspective on like that argument with, oh, we need a single payer system, we need a single payer system. And it really swayed me against that. And I realized quickly we had to find other solutions.
Sure. So, dovetailing on that, I'd love to hear how your experience in medical school was because you went to the Philadelphia College of Osteopathic Medicine and MDDO school. We get pretty quickly exposed to the way that healthcare is, accepted culturally right now in this country where insurance is healthcare. I want to ask here if you had, you know, very stark thoughts about how this healthcare is different. This type of healthcare is still not optimal, comparing it to what you had seen in both Italy and Switzerland.
Yeah, so a little bit about the osteopathic portion. One of the things that I loved about Switzerland and Italy was the way of life. It's a much different philosophy. You have breaks throughout the day, things shut down for mental health time. And as a former Division One athlete, I had also been dealing with the aftermath of a lot of just wear and tear on my body. And I saw an osteopath in Switzerland. In Switzerland, it's two different tracks. You're either an osteopath or sort of like chiropractic almost versus physician track here, or you're an MD. There wasn't a combination track. So that osteopath really opened my eyes to what I sort of already intuitively knew, which was the connection of structure, function, and spiritual values and mental health. And he really helped me a lot. So when I came back to the US, I started realizing, oh wait, there's a combined path almost. Like I can do osteopathic school. And I was going to be a non-traditional student because I didn't go back to med school until I was 28. So it just so happened that osteopathic schools were known to be a little bit more favorable or look more favorably upon non-traditional students. And I think that's really what called to me from that perspective. I'm so glad I did it. There are a lot of osteopaths who you go through osteopathic medical school and you have extra time spent in labs so that you can really fully understand structure and function. We have a really good understanding of the anatomy and physiology of the body, but a lot of people don't use it in their practice, and that's fine. I think it really shaped my practice today and how I view the whole person, why I really push toward a more holistic lifestyle medicine oriented practice. And although I don't specialize in osteopathic manipulative medicine, and I will refer out oftentimes to neighboring physicians who do that.
That's great. And I think that's helpful also for people who are listening and they're very early on in their medical careers and trying to hear the difference between DO and MD, because I know it was a very vague discussion when I was applying to medical school back in the day. So that's wonderful to hear. Now, you also are a family physician like myself, and that is a whole layer of, choosing a specialty that's a lot of, dabbling in lots of things versus focusing on one area of the body. And so I'm wondering if you can also share with us why family medicine.
Yeah, you know what? It's funny. I almost went into emergency medicine and I'm so glad I didn't. I really have this incredible faith in the universe, God, whatever you want to call it, and I truly believe that I have guidance that's larger than me. I'm so glad I went into family medicine now. I think I would have completely burnt out in the emergency room. I'm too much of an empath. At times I've been called a super empath, probably fall into that category. And while it was exciting in a lot of ways, it's a lot of the stuff that you see in the emergency room is very, very challenging. Not that it's not challenging in different ways with family medicine, but I love that I have the space now to have authentic connections with my patients and the ability to have a long-term relationship with my patients. I love that. I think I don't know how we can have a positive impact on someone without those two things, right? Because those that creates a situation of trust. You
Hmm.
have to have a mutual trust and a mutual respect in order to have an effective exchange of ideas. And certain conversations might not be easy conversations. If I'm a stranger to someone, and I realized this quickly. I worked urgent care for a long time because I was single mothering, and that was the space, the only space I knew within the insurance system that would allow me to go home and not be just like overwhelmed with charts on weekends and evenings. And I couldn't do it. I had an infant at home and an older child. And I realized pretty quickly, I don't have any space with this person that I don't know and that's coming in for a 7-minute visit to sit down and talk to them or even ask them. Like, I feel like they might feel like it was intrusive if I was like, what's going on in your personal life? Like, how was your relationship with your partner? Do you feel safe? Is it, like these questions that you're supposed to ask that need to be asked, but there was no comfort level in doing so in the rush system of insurance-based medicine. And so I realized very quickly, like that well, not very quickly, but after I had been in urgent care and I had done outpatient addiction medicine for a while, so I had a little bit of contrast in that regard, that there had to be something else because I wasn't helping people and I was band-aiding.
Yeah. And I think it's ironic because I just spoke with a bunch of chief residents at the UC Davis Residency Network yesterday. And right before that, I had talked with the residents from my former residency. And I just find myself being so uncomfortable when I hear fellow physicians, fellow family physicians talk about how it's great that they'll see so many patients in a day. And when I calculated out what the average was, it was like 12 minutes or less per patient. And they were, with happy, smiling faces talking about how they're not allowed to do OB, they're not allowed to do this or that, and they can't see this particular population. And I'm like, I'm so sorry, but does anyone see the problem here? And it's very, very uncomfortable sometimes for me. And I've expressed this on the podcast and to other people in person, but it's very, very hard sometimes once you've seen what healthcare can be like to unsee what healthcare can be like. So I also want to ask here because even just, being an empath, a super empath in your case, I'm also glad you didn't go into emergency medicine because that is rough, especially these days when there's even more demand on ER physicians. But when it comes to your being able to be empathetic because of your experiences in healthcare, I'm wondering if you could talk to us about how you intentionally then shifted from the service models that you were in to opening direct primary care.
Yeah, so I think it's really important for us to be vulnerable and share our vulnerabilities. And so I'm going to share something that I'm not proud of now, but I was that individual that you were just talking about. So I was at an urgent care that's a chain urgent care, and they were known, and before COVID, especially for 14-hour shifts. So it was like you would do a 7 and a 7, so it would be a double. And then at the parties, we would brag about because we would get paid on productivity. So like the more patients you saw, the more money you could make. And we would sort of joke about it and brag about, oh yeah, I saw 85 patients last shift. I mean, 80 to 90 patients in a 14-hour shift was more the norm at this place.
Wow.
And while that was great in one way because it gave me a lot of exposure to acute stuff, like I knew I could maneuver acute things quickly and realize what tests I needed to get done quickly. It quickly wore on my soul. I And I didn't even realize why I was so miserable or unhappy, right? I didn't know why initially I wanted to quit medicine. COVID hit and the situation just got worse in some ways because the initial COVID, I feel like I saw more acute illness, like the worse illness.
Hmm.
And I had more than a handful of patients coming in respiratory distress that we had to send to the emergency room. It was very scary. And during that process, I have a background as a personal trainer and I am a former D1 athlete and I really started doing more positive habit coaching and I started experimenting with fitness stuff online and on social media because I didn't even know what I was doing. I was just like, I have to get out of this. I have to somehow, and I don't see a path out. Simultaneously, thanks to my mom, she was one of the first female physician assistants ever. She graduated from Rutgers. I think she said there were like 5 or 7 females in her class. She's in her 70s now. And I had been connected with the DPC docs group online on Facebook, and I'd been sort of just stalking, I call it, where they let me on the group. I'm sure a lot of people do this. And I just read. I was just reading other people's posts, and I was afraid to post anything or ask any questions, but I was at least reading. So I knew this other avenue existed, but I was also overwhelmed thinking, oh, this is going to require like me to give more of myself, and I have nothing left to give. I don't know when that turning point was for me in terms of like when that transition happened where I realized I just had to do this. I think that I'm really grateful for my now fiance, who is a really rational and kind human. And he and I had a lot of discussions. We were actually looking into like, just buying some sort of business outside of medicine completely, and my uncle as well, who's pretty rational CPA, him just saying, you have to do something in your profession. Like you have to, I don't know if he said it like this, but for me, I almost thought like, I didn't go back to med school at 28 with a 6-week-old infant for nothing.
Mhm.
Like, I sacrificed so much of my life for this. And I don't know, at a certain point, I just decided that it was time to make the jump. I didn't do it the way that other people do it with a ton of planning. I just was like, well, I'm already 1099 at urgent cares because I got fed up with being forced to cover shifts. Not that I didn't want to help people out, but I was single momming still at the time, and I was just like, I can't do this anymore. So I went completely 1099, and I was like, I think I have enough good relationships with all of the urgent care owners around me that I can just pick up shifts. And again, thankfully to something larger than me, I was able to do that. So for the last 2 years of my career, I was 1099. And what that did was that gave me the space to really experiment with other things. And I was able to get like 2 regular shifts per week and then pick up extra shifts on top of that. And then as I transitioned into my DPC practice, I was able to talk to my employers and say, hey, listen, could I drop to 1 shift a week initially? Would that be okay? This is what I'm doing on the side. I need to do this for me. And again, I relied on that authentic human contact with someone who thankfully they understood me and they were able to accommodate, and they understood that I needed to do this for myself. And so that's was sort of my entry point into direct primary care. I hadn't even gone to a DPC conference in person yet, to tell you the truth.
And I will say that you're pointing out that you don't necessarily have to like, to be able to open. And I will put here also that as you're describing how you picked up shifts and you had a good relationship, for those listeners out there who, might want to do something like Dr. Mincer is mentioning, but might not have those relationships, I definitely encourage you to check out the Rise Up Summit. A couple of weeks ago, I interviewed the two people that I'm working with to put together this DPC locums and direct contracting specific conference. So if you're wanting to do your own direct contracting, not going through locums agencies, this is where to go to learn all of that, as well as more stuff about DPC. So check that
That's
podcast out.
exciting.
Yeah, we'll put that link in the notes. But let's fast forward then to, a little over a year and a half ago, because you are now at about 200 patients. It's a very different world. And that's fairly quick, in terms of going from in terms of how you mentioned you didn't necessarily have this, long business plan that was
Zero
mapped out.
pre-signups. Yeah.
Yeah. So tell us about how Love Health Direct Primary Care launched.
That's a really interesting story. I think we made the decision, I should say, for me to do this. And I think in 2 months I was up and running. Like I put this intention out into my world. I was already doing my yoga every day and channeling my intention, and things started to fall into place. I happened to be interviewing for a medical director position that I knew I could do part-time. And right downstairs in the same building, there was this place called Flourish. And I'm like, what is this? And it said appointment only on the door. So me being the Gemini that I am, I'm like, it looks friendly. I'm just gonna walk in quietly and see what's going on in here. So I walked in, and it was all women in here. And I said, well, what is this place? And she said, well, this is like a collective, like we do behavioral therapy. And then there's the owner of the space is a pelvic floor occupational therapist. And, we have a nutritionist in here and we have massage therapy. And I said, well, I've been looking for a space, and this is sort of my idea of what I'm going to do. It's hard to just tell random people you can't just say DPC because they don't know, especially in Pennsylvania. And I said, well, can I rent a room here? Is that what you're saying? And there's a shared space. And she said, actually, we have one room left. And I think it was that week, on Thursday night, we're having a networking thing that you should come to. And so I cleared my schedule because I have my kids on Thursday nights. I cleared my schedule and I just showed up, and it was like 60 women all in one spot. And they're all different areas of providers, right? Most of them out of network, right? Most of them. And Danica was here, who had sort of made this space. She took out a large lease and then subleased. And I took the room like within a couple days. She sent me the lease and I took the room. I had one room to start with. And that was the birth of Love Health. I had looked into a couple of other places, but they were all going to require, they were retail, so I had to $50,000 in a build out fee. And I'm like, I can't do this. I can't take this risk. I have children at home. And that was the birth. And I always tell people this, that I really believe in trying to start, if you're starting this, without going into a ton of debt.
Mhm.
Like I think we have so many options for space share situations that can be very supportive these days, that I really think that's an ideal situation for anyone wanting to start a direct primary care practice, because that's really how you contain costs. And in my mind, it's really how we can continue to keep our membership rates affordable I always say affordable for most people. If my membership rates are less than what you pay for your cell phone or your cable TV every month, then that's an affordable rate, to me at least.
Yeah, and I love that you're mentioning, ways to be innovative when it comes to finding space to keep your overhead low and to keep your membership as part of contributing to your overhead low. Dr. Marcy Meyer was one example of this season on the podcast who talked about she's got space and I would love if somebody came here and used the space as an incubator space before they moved into their own. And so it's a very different world than the non-compete BS that we see in the fee for service corporate models. So tell us about the name, because I'm wondering, because there's some listeners out there, I'm sure, who are asking the chicken versus the egg question. What came first, the lease, or did you have Love Health? And tell us about the meaning of Love Health.
Yeah. So let's see, I'm, I had the lease first before I had the name. The name was born actually, well, obviously from years of just experience before that, but the actual birth of the name was on a phone call with Keen, who, if you don't know Keen, at Atlas, and I want to just give him some thanks to like helping me work through the name. I wanted something simple, and I wanted something that really communicated like what I was trying to do in the world. And love, just acting from a place of love, speaking from a place to love, that was really what I could think of. That's what first came to mind. And it's something that I wish that I would have had as well going through the system. We didn't touch on this yet, but when I was in my first year of residency, I was exhausted, and I was actually to the point where like I was having trouble swallowing. I couldn't swallow liquids, and I was fatigued and exhausted, and I couldn't get time to take off to like care for myself. And this is a prime example of how our medical trainings, traditional medical training, even if it's osteopathic, it does not teach us any type of self-care. It just doesn't. And I ended up going to the GI doc who, was on call, and I was like, I can't swallow. I don't know what to do. And so thankfully I was able to get time off just for that day to like he took me in and scoped me, and then I was able to get to an endocrinologist. So I was hit with Hashimoto's and eosinophilic esophagitis like within a couple weeks, I think, of each other. It was just a disaster. And I realized, for the EOE at the time, I went to one of the top people who was doing all the research at one of the top institutions in Philly. And even with endocrine, I just was sort of grossed out and disgusted with the care that I got. I felt very rushed. I felt very gaslit. And when I brought up integrative options or even just the idea of like an elimination diet instead of swallowing steroids every day, I was made to feel like I was less than. I was made to feel like I didn't know what I was talking about and how could I even be considering this? I know the research. I'm a doctor, like evidence-based medicine. And then that led me on the path to like trying out fully functional medicine. And I felt equally, but in a sort of different, but equally sort of turned off in a way because I felt like there were like 20 different supplements thrown at me. And it was overwhelming the amount of testing and I I needed to find a median. Like I needed to find a somewhere in the middle. And I feel like that really has been a theme of my life in general is recovering from my own autoimmune stuff. And not to mention when in my late teens and early 20s, I was suffered from such horrible anxiety and depression. At one point I was hospitalized. So which these have all been blessings because now it's I get it. I have patients coming in and I can look at them and honestly say, I understand. And these are all of your options. And let me just tell you, like medicines can work so much on this, but we really need these lifestyle interventions to have you be in a happy place. I can tell you I'm on the other side right now. So anyway, I just realized early on, and I don't know if I realized it at the time, but this really shaped how I structured my DPC practice in terms of I want to communicate authentic love for people. I'm very humbled. I'm blessed that people are finding me to act as their humbled advisor. And I'm grateful for that every day. And I want to bring that love and gratitude to my moment to moment interactions in the world. So I think that's really the story of how Love Health was born.
It's beautiful. And I will ask here too, because as you speak to these things that have happened to you in retrospect are a blessing because they're enabling you to be the person you are today. And I love that because I think that that is what we all are doing, but sometimes we don't necessarily recognize that past experiences are a blessing in disguise. Before this interview, you were mentioning that your burnout level was a 10 out of 10 before you opened DPC. And I'm wondering if you could speak to the differences now and where you are on that quote unquote burnout scale because you have this practice where you can be in a relationship with your patients.
Yeah. So I just want to put this out there. I'm probably working more now than I was before, right? As an entrepreneur, it's just nonstop. And we have 4 kids at home between the two of us, and we go back and forth between 2 different states because we met long distance and it's about 5 to 5.5 hour drive, and we make it work. But I want to just point this out that oftentimes when you're in the midst of the burnout, you don't see it, right? It's the same concept as I say, like I find just because of my past experiences with narcissism in a relationship, I'm attracting people that need some assistance in that arena. And I liken it to the same thing, like when you're in some sort of abusive relationship or so oftentimes you don't see it in the moment. So I think that if there's, other people listening to this that might think that they might be a little bit burnt out, it's sometimes it's worse than you actually think that it is in the moment. And that takes a lot of sort of being present and mindfulness to be able to come to terms with really at what level are you. And then there are other people that are so burnt out that they're on the other spectrum and they're feeling suicidal because they're so burnt out and they don't even realize, why how the suicidalness and the burnout are connected. And I just want to make everyone know that there's definitely an alternative for every horrible emotion. Even if it feels like the end of the world, there's always an alternative for that. It just might take a little time to come around to. And so now, before I remember even as a burnout urgent care doc, I would talk to other docs if they were willing to listen, especially if they were younger than me. And, a lot of the messages that you get are like patients were calling frantically throughout the day, and the urgent care doc is busy. And in our area, it was single staff, meaning like one doc on service at a time, that's it. And sometimes people would express in meetings like that they were frustrated with patients being ridiculous and calling throughout the day. And I tried to give people another perspective and say, hold on, wait a second. Let's flip this around. So you're the patient. You came in before closing last night and somebody gave you an antibiotic and you're now having a medication reaction, you think, to this antibiotic, which is common. And now there's a new doc on the next day that doesn't know you and you're used to calling around. The primary care doctor that you called said, we don't want to deal with this. Go back to the urgent care because we didn't prescribe the medicine. But then that primary care doctor couldn't see that patient to begin with. That's why they ended up waiting in urgent care for 2 hours to see a doctor for 5 minutes max. And they're expecting that nobody's going to call them back unless they continue to call frantically. So, are we gaslighting this patient by calling them crazy? And my answer to that is yes. We're creating this chaos. We're creating this situation by being in this system. The system is creating it. I wouldn't say the doctor itself,
Mm-hmm.
but so I would always encourage people to just think about things from that perspective. If you had more time, if you had calm during your day to some extent, and obviously not every day is calm. I had a patient emergency this morning that I had to do a juggling act for a little bit, but what would your empathy level look like, if that
Mm-hmm.
makes sense? I got to a point where I realized I didn't want to hear what patients had to say. And I was like, that is not who I am in the world. This is
Oh.
not who the universe, God, whatever you would have created me as. And something is wrong here. I need to really sit down and examine this. And thankfully, I really and I'm not trying to convert anyone to like a different religion, but I really thank my yoga for this. Years before that, I had started a daily yoga routine. And it wasn't like I'm going to a yoga studio every day. It was like I come home or I get up in the morning and I do my 10 to 20 minutes of yoga once a day. And I really credit that to being able to give me some insight into the fact that it was me. I was burnout. I didn't want to hear anything more than a superficial level because I didn't have space for it. It's like,
Mm-hmm.
what I see it with teachers a lot of the time. A lot of teachers can relate to this where they're going, and my daughter's soon-to-be stepmom is actually a first grade teacher, and I remember having this conversation where it can be challenging, but so you're going to school all day long, and you're like dealing with first graders all day long, and then you have to come home to a first grader, and it's just nonstop, and you have no energy left to give. You have no oxygen to put on yourself before you, right? There's not that concept. So I guess that was a long-winded answer to I am working more hours now, and entrepreneurship is definitely not for everyone. Let me put that out there. It definitely takes a certain human to be an entrepreneur. And if you are not that person, that is totally okay. I think it's really important. There's a couple good books that I can recommend for people to read to determine if you are of that spirit or not. But that's also leads me into another thing of why I realized very quickly that going into DPC was larger than just me. I realized that for myself, I couldn't just stop at opening my DPC practice and having my 400 to 600 patients. That there was something deeper in my gut that was like, I have to keep going. I need to get to more patients. I need to provide employment that's like lifestyle medicine employment to other providers. And it was larger than me.
It's awesome. So I definitely want to hit on what is happening to expand the mission of Love Health. But I want to ask here before we go there, what is your typical week like?
So the great thing about DPC is I can structure my week however I want to structure my week, which is awesome. Like I always envision this as for anybody that comes on as a provider that's not running a business, just manage your 400 to 600 patients and you can set your hours to Tuesday, Wednesday, Thursday and just be on telemedicine coverage for the rest of the time if you need to or like I go down to my now it's my other home. I mean, it's just because we have to manage two households in two different states because we have, you know, joint custody with exes and kids involved. But I go down to Virginia for one long weekend a month, and I love our home down there. It's in the woods, and I can do that with DPC. I have a 1 o'clock parade at my daughter's school, and you better believe it, I'm gonna be there because you only get that chance once. That doesn't go like your children are only having that experience once. And then there are other times where it's, when if I don't have my kids, I work late. Like Mondays and Tuesdays, I work late and I work long. Sometimes I'm here at the office until 11 o'clock at night, but I'm also doing way more than just dealing with patient stuff. Like I'm developing a business. And my kids may have an activity on those evenings with the other parent that they're doing, and that's just not an activity that I go to on a regular basis, and that's okay. But overall, like I have long days on Mondays and Tuesdays when I'm having my kids, and then I have shorter days on Wednesdays, Thursdays, and Fridays, and I can drop my kids off at school in the morning, and actually this morning I rode my daughter to school on we have a double bike. She has her own bike, but she's going to her dad's house this afternoon. And she was having a little bit of a hard time getting out of the house, and so I was able to shift some things for her, and we got to school a little bit late, and we could take care of her emotional needs. And then on the days that I have my kids, I'm able to do a hard stop when I need to at 3 o'clock to get out of here in time to pick them up. So it's actually really nice. There is some juggling that has to happen. Sometimes they need to watch a TV program in the evening for 45 minutes to an hour while I get on the phone or finish up a couple things. So it's definitely a little bit of a juggling, but overall, I think it's much better control. I don't feel guilty. I don't have to request from someone that I have time off. It's really just incredible in that instance. And if I have a sick kid, the best thing about it, and I'm so grateful for my patients, and I share my personal story with most of my patients at some point as they come on as patients, and they all know that I'm a mom. And so if I have a sick kid, my kid's either going to come in with me to the office or I switch my patients over to telemedicine for the day. And that way I can be home, and I can be present. So,
I love that. And I will
yeah.
say that is something to expect in DPC almost. I have so many patients who they hear the kids shouting in the background and they're like, just call me later. We don't need to have this visit right now. Just call me later. And, even if it's an acute thing, they're also fine with, you know, deal with what you have to do and then call me when you're free. I'll be up late tonight or whatever it is. And so I love that this is a thing to expect when you do have a relationship with a group of people who also value you as a person, and they understand that helping take care of you in terms of being members of your practice, helping you financially, but also making sure that they're taking care of you so their doctor can be there for them. It's a very different it's a very different culture shift compared to what we have in the fee-for-service clinics where you're seeing a patient every so many minutes. So I love that. So now let's talk about expanding the mission that you have at Love Health. When you talk about having expansion of lifestyle focused care delivery, I'm wondering if you could also talk to us about how your patients are not seeing you every 12 minutes, how you're delivering personalized lifestyle medicine focused care to your patients, and then how you're expanding that into the greater community.
Yeah. So one of the things that I spent a lot of time contemplating was why lifestyle medicine was a separate specialty. I,
Sure.
you know, I realized I think that, and not everyone's going to agree with me on this one, but I think that there's two main reasons. The one is that as physicians, we are not taught lifestyle medicine. We're not taught self-care in any way. In fact, going through the entire system between med school and residency is like completely abusive. It's a terrible system where you get high touch and a lot of hours, and I'm not saying it's not necessary the amount of hours, but it does not teach self-care in any way, shape, or form. And so if you can imagine, like a lot of people just go straight into that. It's like they just school, 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 and there's not really like a life experience in between that outside of studying, and it's about, just I need to get good grades so I can get into med school. The other issue with separating it was that the time issue, because lifestyle medicine takes time, right? There's a lot of stuff that we need to talk about, and you just can't practice it within the guise of a 7 minute to 12 minute visit. It's impossible. Even I find even half an hour visits, I need more time. Yeah. So so basically, I initially started by just saying, well, again, I was lucky because I had zero patients when I started. And we literally, I think the only thing that I've put money into was I tried to get a website that was like SEO optimized. I just tried to get a little bit of help with the website. And above and beyond that, it's just been word of mouth and So my initial appointments sometimes were like 2 hours, and sometimes they could still be close to 2 hours, depending on what people have going on. Sometimes I had an appointment the other day that went almost 2 hours for an initial patient. They needed that. Sometimes my initial appointments end up turning into more of a positive habit coaching or more like a mental health, spiritual health, therapeutic interchange and exchange. And my follow-up appointments, I've been still tweaking this. Initially, I wanted, so we want to be able to show metrics. And so I have my visits pre-coded with CPT codes because I want to be able to pull data from that so that I can show that to employers because I realized quickly like that's one of the best ways that I can actually show them value is to code everything. So my follow-up visits were coded and initially were half an hour, and I actually just recently changed them to 40 minutes because I just realized with who I am and who my patients are, people just needed more time, and I'm gonna, experiment with that. Obviously, there are still more acute visits that I'll squeeze in, but I always try to tell people, listen, like I want to make sure I see people same day for issues that they're having. And that doesn't always mean they're coming in person. I have a lot of visits that I can do over telemedicine. Even if it's a musculoskeletal type pain issue, I can oftentimes do that and I have them, okay, can you push on your neck? Can you push here? And I can do a full physical exam that way. And I will usually tell people like, hey, this is an acute visit. I'm squeezing you in. It's a 15-minute time slot. I try to give them that expectation in advance, and people are totally okay with that because really, where else are they going to get seen same day other than urgent care? And I think people have an appreciation for the fact that I'm like just moving things around and making time to get on with them. So that's how I structure. I don't know if that was like really an answer of like how I structure things differently than insurance-based system. I
Mm-hmm.
try to just really make sure we're giving people time. And then obviously just like the general model of it makes it where we are able to get back to people same day. I imagine myself before going into medicine having an issue, even if it was just like I have a really horrible sore throat, I don't know what to do it's 10-minute conversation maybe with people just to figure out a plan. And most people are reasonable about, hey, I'm leaving the office right now, but can you take some ibuprofen, gargle with some warm salt water, and can you pop in tomorrow at this time and I'll do a throat swab on you if it's still hurting. And
Mm-hmm.
most people are totally okay with it. They need a sounding board to figure out what to do. I had another patient this morning that I was actually more concerned for something, and I ended up ordering a CTA of the neck just based on the symptoms that she was having. And I am lucky because I've made partnerships with imaging centers and I've been going direct to physicians and organizations. And I called up the imaging center. I said, "Hey, I need you to get this patient in. They didn't have a blood test for kidney function within the last month, but she's healthy. She's had one done in the last year. This is the issue." And voila, they're taking care of it for me. And they're actually doing the pre-cert for me as well. Though I did use open evidence I love that by the way. I use open evidence to fight with insurance companies all the time because I can say, these are the symptoms that my patient's having. This is what I need to order for them. I need you to write a letter to the insurance company listing with citations why they need to be, covering this test. And so I was able to send that over to them for assistance as well. So I guess that's where things differ, and when you have more time, also, we don't have to refer. Like, I had a patient who I previously probably would have sent to hematology, but I was like, she didn't want to go. I said, I totally get that. Let me do a little more research. Let me see if there's any additional tests that maybe hematology would be getting that I can get for you, and just to double check, and then we'll regroup. And, you know, it's amazing what you can do with time.
Awesome. And it's amazing what you can do with time fueled by transparent pricing and ways to be innovative in healthcare because you're not tied to insurance. So wonderful to hear your way of creating a DPC ecosystem and expanding it where you are. So I love that. Now, I want to close with the fact that you're doing all of this for your community, but you're also continuing to take care of yourself. And as you pointed out a few times now, self-care is not something that is, typically taught in med school in the way that we become doctors.
I've taught yoga before and I've been a daily yogi for many years now. And I'm finally sitting for my 200-hour teacher training certification that has a trauma and somatic informed certification with it as well. And the first step toward realization of truth is awareness, right? I see this over and over again with burnout. There's a lot of anxiety and sometimes depression that comes with burnout. And we're looking for quicker fixes in the form of SNRIs, SSRIs, different medications. Or people are like saying, I'm exercising every day, like I'm weightlifting and I really try to distinguish between two things. What are you doing for your 10 to 20 minutes of daily self-care slash cortisol lowering activity? And most of us don't have that type of regimen intact. Like it's just not even, people think about yoga and they're like, I don't have time for that. I have to get to a yoga studio or I have to get to the gym, and most yoga classes are an hour long. I mean, it's the same pattern I see also with the positive habit coaching that I do within the realm of weight loss. I hate calling it that. As a personal trainer as well myself, is like people see it as it's an all or nothing thing. Like I'm either going to get to the gym or I'm not. Like there's not a middle ground. So I would highly advise anyone who's in that space to just put a YouTube video on. Don't motivate yourself, because by the way, motivation is a word that should be stricken from the English language. It is the stupidest word I've ever heard. I don't know who invented that word. If you know, if you could please write me and tell me who invented this word. We have reptilian brains. We are not motivated. We are creatures of habit. So we need to stop relying on motivation, right? You just need to get 10 to 20 minutes a day, put any YouTube video on. I can make suggestions. I do it myself. Even though I teach yoga, I don't teach myself yoga. I put a YouTube video on because I have a lot going on. And just get to a place of 10 to 15 minutes once a day where you're yoga will allow you to get the physical energy in your body out, like the physical asanas, prepare you for Shavasana, which is a resting meditation. Most people that I know cannot just go sit down and meditate. It's going to drive you crazy. It's going to feel so uncomfortable, like you're jumping out of your skin. And you're not alone in that. This is most of the population that I talk to. And so doing something to prepare your body for a quick rest and relaxation is going to help tremendously. And I don't know any other better way than doing that and being able to start with that 2-minute meditation at the end that's going to bring more awareness to your current situation than that. I can't tell anyone what the right thing is to do for your life. Like I see you, I respect your sacred autonomy, I respect your sacred humanity. You in the end need to know that. But what that 2 minutes of time will do, and maybe it expands to 4 minutes or 5 minutes, that will help to really deepen your connection to your intuition, which a lot of us have lost over time. And that in itself will help you decide what the next step is for you. For people that are considering DPC or some alternative, I would say just call one of us up. Like just there's a whole network of us, right? And if somebody called me up, they're like, "Hey, can I just come in or talk to you and figure out, what does your practice look like?" There are times when I'm busier and I'm just like, I cannot do this right now, but I'm also in startup mode. But I'm sure there are a lot of us who are not in startup mode who are more than happy to say, yeah, come on into my clinic, like come observe, whatever, come see about what's happening. And just like that Facebook group with the DPC docs is really, really, it's a helpful forum. It's active all the time. Plus, there are statewide DPC. I'm a member of the PA DPC docs and then the Virginia DPC docs, and just it's a great place to start to see if this could be a good fit for you or not. So, and I just want to put this out there for anyone that's really struggling with burnout or depression or feeling at all like you're having suicidal thoughts. I want you to know that I have been there. I get it. And there is another side. There's always there's the opportunity to get to that other side, and you just need to reach out for some help. Who is it Dr. Pamela Weibel, right?
Hmm.
That
Yep.
she's amazing. If you're suffering at all, she's got an incredible support group online as well. I find that oftentimes going inward and making some changes to the external stressors will create a whole new reality for most people.
Thank you so much, Dr. Mincer, for joining today and sharing your story.
Thank you so much for having me.
Thank you for listening to another episode of My DPC Story. If you enjoyed it, please leave a 5-star review on your favorite podcast platform. It helps others find the show. Have a question about direct primary care? Leave me a voicemail. You might hear it answered in a future episode. Follow us on socials at the handle @MyDPCStory and join DPC Didactics, our monthly deep dive into your questions and challenges. Links are at mydpcstory.com. For exclusive content you won't hear anywhere else, join our Patreon. Find the link in the show notes or search for My DPC Story on patreon.com. For DPC News on the Daily, check out dpcnews.com. Until next week, this is Marielle Concepcion.